Okay, welcome to everyone who's joining us here today. Thank you for joining us for today's webinar, Better Mobile Communications for Patient Engagement. My name is Linda Adams. I am the Global Field Marketing Team Leader here at Soprano, and I'm fortunate to be here with our Product Marketing Manager, Jane White. Hi, Jane.
Hey, thanks for having me. I'm looking forward to it.
Great. Just some quick housekeeping for everybody. We will be recording today's session, so if you want a copy after the fact, just let us know. We'll also be sharing the slides at the end of today's session, and we will have some time for questions at the end. So if you have something that comes to mind during the presentation, you can either ask us that at the end, or feel free to use our chat feature on the side. And with that, let's go ahead and get started. Our agenda today, we want to talk to you about how you can strategically use mobile communications to improve patient engagement. So today we're going to look at patient engagement from the 30,000 foot level and discuss what today's patients need in terms of communications to improve that engagement. We want to examine some of the common use cases for mobile messaging in healthcare today, but then we want to put that together and talk about how you can take those and expand or optimize the way you're using mobile messaging throughout the patient journey. Finally, we'll have some time, as I mentioned, at the end for questions, so you feel free to ask us. With that, if everyone's ready, Jane, you ready?
Yep, I'm ready.
All right, let's get started. I'm going to start you off with a question, Jane. Why is it important for healthcare organizations to get patient communications right?
So many reasons. That's a big question. In the context of this discussion, I think the key thing to think about is just how much money and effort we've been putting into digital transformation and how impactful all those changes have been on the whole patient experience. And then, of course, at the same time, we're also thinking about how a lot of those gains are happening in a way that not everybody's able to see those benefits.
So
if
can you talk
next,
about that a little bit? Yeah.
Yep. For example, we have demographics and especially underserved communities where people aren't able to access care in the venue that it's being offered to them. So in this case, I'm talking about PCs, where folks who only have one device or another are more likely to have a smartphone, and then they don't have the PC. So in preparing this discussion, I actually ran across an article. This is published just a couple of days ago. And we're looking at a huge city, St. Louis, which you can see a quarter of the households there don't even have PCs, much less high-speed internet.
Yeah, so access just to even broadband is an issue. And when you talk about those digital tools that healthcare organizations are implementing, sometimes that becomes a problem for those marginalized communities. But it's not just the underserved, right?
No, the question of which device to offer telehealth on is also a question of preference. So in this study, we're seeing that more people prefer to access telehealth via their smartphone. And then, of course, study after study, we see this as a general trend. People want more access and more channels of communication through their smartphone with their healthcare providers.
So, people are leaning towards their smartphones as a way that they want to communicate with healthcare providers. It really makes it important to build the communication strategy around mobile channels. That seems logical. So when we look at healthcare organizations and their use of mobile messaging, what's the most well-adopted use case today?
Well, appointment reminders are definitely the big one that comes up in anybody's mind. It's the number one, I think, use case anywhere mobile messaging is being utilized in healthcare. So basically at this point, we're seeing it's become an industry best practice. And it's pretty easy to understand why, we're seeing with healthcare the same thing as any other industry, where mobile is so much more engaging, the response rates are so much higher. And then when it's implemented for something like appointment reminders, you then see a huge reduction in missed appointments, and you get a lot more people showing up on time. So you're saving that loss of revenue, your whole office is more efficient, And then of course, on the other side of that for staff, when somebody misses an appointment, they're calling in to reschedule, or you have to call them and say, you missed your appointment, now we need to reschedule. And that staff time and those logistical exercises are all unnecessary when you have appointment reminders getting people in, and they can even do the rescheduling for you as well.
Interesting. So if you're a healthcare practice and you're not using appointment reminders, that should be step one, I assume.
Yep.
But okay, so but if we're going to really take this to the next level, let's look at some other ways that organizations can strategically integrate mobile messaging throughout the patient journey.
Yeah, off of that, I would just say we consider appointment reminders right now to be sort of like the first generation of communications in the industry, but there's so many areas you can expand beyond that. And a lot of these different expansion opportunities are all around the question of access that we're talking about here in the slide. So for example, if you're not using two-factor authentication to get people that secure access to their health portals, then you're obviously exposed to risk. It's a really easy way to add that extra layer of security. But then on top of that, I know we have had discussions where we're thinking, how easy is it actually to access whatever online portal you need to get to start an appointment? And for some people, it's a bookmark that they bookmarked months ago, or it's buried in their email inbox, and they just aren't ready when they need to be. And if you are sending a timely communication with a link and any login help that a patient might need, then you're taking that problem away completely. And then of course, if people have trouble, what we see oftentimes is that front office staff in like just doctor staff, healthcare staff, are having to act as IT and troubleshooters for folks who can't then navigate whatever portals and tooling has been stood up to get them that telehealth. So that is another drain on resources that is really unnecessary when you can have a two-way conversation going via chat, easy access to help, and a direct line to, that end result, that last step they want to get to.
It's so funny you mentioned that, not, the buried email. I've actually had the frustration of trying to find a link to log into a telehealth appointment. It was booked 2 months in advance. I logged on 5 minutes before I got into my MyChart 5 minutes before, looked for the link, and there's no link. And I call and they tell me, oh, that was sent to you in an email 2 months ago, which I have no idea where that is. And the funny thing about it is they even sent me a text to remind me about the appointment, but it didn't include the link to the login, and that would have been just such an easy add, I think. So it's just, I think, thinking about things in that way is how can you even make those little incremental improvements just to improve access is such a way to reduce frustration of patients from my own personal experience.
And here, on the screenshot, I want to just point out you're prompting people to ask for help before they call in. So that's another just call reduction tactic, super important for efficiency.
Yeah, that's a really great point. So as healthcare organizations find more use cases for mobile messaging, what's the next step they would take after this towards patient engagement?
So if we're expanding even further, I like to talk about the whole patient journey. And there are endless places when you look at that entire journey where, a well-timed or thoughtfully designed communication can reduce a lot of friction. So I'm talking about the patient journey as the patient sees it, where it's not just a single department. It's not just what would be walking up to the front counter and talking to the first person and then the doctor. It's the whole step from arriving on a healthcare campus, receiving care, the follow-up, all of those surrounding steps of the journey. You get the idea. So there are a lot of different things that you can do to reduce friction when you look at it from that perspective. So one way is to promote short code access to your patients and say, hey, you can use these inbound keywords to have a direct conversation with a specific department. So for example, text EN to 34007 to get a chat started with our endocrinology department or something like that. And then of course, there's an opportunity to supplement all those things that need to be done online around and before an appointment via links. So if you have some standard pre-appointment prep that you need to do, paperwork, even paying your copay, all of those things can be done via a mobile conversation and prompted automatically that way. And then of course there's other use cases, and these are the ones that I think are really exciting because they require more creativity, but then there's mutual benefit for the stakeholders that collaborate. And I'm talking about, when you get cooperation from adjacent like logistical partners to that patient journey, to the hospital itself, let's say like a pharmacy or a building management type of cooperation where you can then offer incentives or just make the whole process more efficient.
That's interesting. That's an interesting use case. Like what might something like that look like?
Yeah, so our examples here, we have a parking incentive. Yeah, this slide we have on the left, basically we're saying to a patient at some point in the patient journey, hey, if you get this paperwork done, or if you pay your copay online, or if you do these things 24 hours in advance of coming in and you're on time, then we're going to give you free parking at the in-person appointment. So instead of making that another logistical issue for the front office staff to then orchestrate, you could just have it sending automatically after the paperwork is submitted straight to the person's mobile device. And it's a win-win for the building management and for the front office staff. Whatever deal that they've made to make this happen just ups the efficiency. And it's a nice experiential boost for the patient too. And then we also have an opportunity to get a lot more people in and effectively planning for themselves their preventative care. So I bring this up because, in my life, after I stopped having my parents take care of my doctor's appointments, I started putting off my preventative care. And then some time ago, I got a mailer that said something like, it's about time for you to go in and get these x-rays done, or have you checked on your wisdom teeth, or when was the last time you saw a gyno? So all those different pieces of preventative care that I'm not thinking about day to day, getting this mailer is honestly a miracle that I opened it, and then I promptly forgot about it because I wasn't at my computer or on any kind of device. And then I was thinking it probably is a lot cheaper to send these messages out more broadly via SMS. And in fact, you can use demographic information from an EHR, for example, to then give those messages to the right people. And then finally, I really think this is the kicker here. You can make those messages actionable. So in the screenshot we're putting up here, we're saying, suggesting that maybe it's time to get screened for breast cancer. You can reply with a keyword to start scheduling right then and there. So that actionability, I think, adds a layer that is, you really can't replace that in any other channel.
Yeah, that's a really interesting use case because I'm at the age where my parents stopped doing that a long time ago, and I have a lot of screenings I've got to get done. So that would be really something that would be quite helpful. So as you put all this together, what's the final step you recommend to truly look at this from the 30-foot level and optimize the journey?
Well, I think when organizations are doing patient experience via mobile communications really well, they're doing kind of what I discussed earlier, where they're designing the communication experience end to end. And they're trying to make a cohesive and consistent experience across departments and pretty much any health related experience that a patient would have surrounding those communications. It's all going to be consistent. So for example, if I get a text message from the endocrinology department at Swedish, our local healthcare provider here, like 24 hours, 48 hours in advance of an appointment that I have, or I go in every year for a certain blood test, they're going to text me about that, then I would expect that same type of reminder, same type of communication from other departments. And in fact, it would be really great if everybody used the same SLA so that I would be expecting that and not making mistakes because the expectation wasn't met. And then of course, when you're doing new things with patient journeys and communications, getting feedback on that is really, really critical. And if you're getting those emails or that in your EHR system or something, it's just the response rate is going to be the same in difference as other channels where it's not going to be anywhere near as good. So if you get a text right after you leave your appointment automatically that suggests, hey, now would be a great time to give us some post-appointment feedback, you're getting it basically real time. So a much better way to get that feedback. And then finally, we want there to be consistency no matter what channel you're using. So the idea that we wouldn't kind of lose the plot depending on what channel you're in, or if you do have to send some things back and forth via email, that of course is really critical too. So to kind of make a through line between those channels is important as well.
Yeah, that is very important. And the one thing we haven't touched on, and I think it's probably going to come up in people's minds, is privacy issues. So because of HIPAA, privacy, personal information, healthcare organizations probably can't do everything with mobile messaging. But we know that in an optimal world, and if you have proper security protocols and tools in place, there is the potential for a lot of that info to be passed between patient and provider. And as you talked about, they may communicate via email one time and text another. So tell me about what a possible solution to that might be.
Yeah, I've on this next slide put up a screenshot, not a detailed screenshot, but some details about our conversations feature. So with Soprano and our product Soprano Connect, we have a feature that does just what you're talking about, where the communications are unified. So if you have a chat message going via SMS and then some other communications going back and forth in email or in an EHR system, even call logs, those things all will show up chronologically in a single chat window, and it's searchable. So that context that's needed for the next interaction and that history is all there. And it's not just super convenient for the people trying to orchestrate those communications and to catch up with a patient on whatever topic is at hand, but it also just, it can lead to better healthcare outcomes because you always have that data right there. And if the patient forgot something or they're expecting you to know something, it's there's that history, which is, like I said, really important.
Yeah, I'm loving this feature the more I learn about this one. So let's talk about how, we've talked about all of these ways to make it better. And obviously we're from a mobile messaging company and we've done this with healthcare organizations around the world. So can you talk a little bit about how our Soprano Connect platform actually does the things that we discussed?
Yeah, so this slide is, it's heavy, so I will kind of orient us here, but this essentially is a representation of the entire Soprano Connect platform, and there's lots and lots of features. You can see there's a multitude of bullets here, but we segment it this way and sort of frame it this way because this is where we start when we're designing communications, and then where we go once we know we need to control those communications for different regulations and policies. Because at Soprano, we have a long history of working with like financial institutions, healthcare institutions, governments, all those highly regulated industries where that's important. So up there in the top left, you'll see there's like an engagement quadrant. That's the tools and levers we have that we put in place to create communications with external audiences. So anybody who wants to design the way a message is delivered to an external audience, all those features are right there for them. And then of course on the operations side, that top right, that's more of those internal operational communication tools that we have, a lot of staffing and things like that. And then down on the bottom where it says control the experience, these are the two buckets of features and tools that we offer to help people meet those compliance and regulation checkboxes. In healthcare, when I was just talking about conversations, it might be coming up in people's minds that conversations feature is not that useful if the doctor has to be the one orchestrating all those messages, or if we're sending automated reminders and then we're having two-way conversations and we can't have sort of like a lower level staff or some other type of administrator orchestrating those messages. Or if we have cross-departmental collaboration, we don't want to be passing personal information back and forth. So I want to point out down here there's a bullet point, masking and visibility controls are 2 in that compliance box. And that basically just means you can send text and orchestrate communications while having the actual patient information blocked from your view. So if you're not wanting whoever's orchestrating those messages to see that information for compliance reasons, it's protected. And then of course we have a lot of features here to protect the privacy and the overall platform security. Again, that's really important. And then I do want to point out one more, that's cost centers and controls. So again, we're talking about bringing departments together to create a cohesive communication experience. And it might be the case that those departments or those stakeholders that are cooperating together have different budgets for communication. So when you have separate cost centers and those controls, you're ensuring that it's separate in the way that it needs to be, but cohesive in all the ways that it can be.
That's great, Jane. Thanks for that information on this. This is really good. So that brings us to the end of this part of the conversation. Thanks to everyone who's here today, and we can open this up to questions. Let's see, I think I've opened this up to anyone who would like to ask a question. You can unmute yourself and go ahead and throw something out for us. Anybody? All right. Well, thanks for joining us today. Really appreciate everyone taking a little bit of your day to join us and learn about this. Obviously, we are here if you have any questions after the fact, when you start thinking about this. We will be sending this material out to everyone who has attended here today. And with that, hope you have a wonderful rest of your day. Thank you again for joining us.
Thanks all.